Good afternoon, I'm Dr. Rick Barrett. I am a chiropractor. This is Barrett Health Centers here in Missouri City, Texas, and we've been in business for about 30 years and we've treated well over 10,000 patients, and I'm happy to talk to Bertha and Ambrose about Bertha's x-rays today. Bertha, sorry you couldn't be with us. Ambrose wanted me to do a little introduction so that you can have this for posterity. So we're about to speak about your x-rays, and we want to do a little intro first, just to give you what normal is, and Ambrose, you're going to have to pan on this a little bit, but this x-ray, if you can see the laser pointer going to this picture here, from the rear the spine should be perfectly straight. That's absolutely normal, and that's like looking at your house. It should not be leaning towards your neighbor's house. This may be a little harder to look at. I don't know if you can see up here, Ambrose, but on this picture here, can you catch that? The spine from the side should have curves in it. The curve in the neck is forward, curve in the mid-back, what we call the thoracic spine, is forward, and then the lumbar spine is forward. So I may have misspoken. Let me make sure I say that again. Forward in the cervical, forward in the lumbar, opposite in the thoracic, going towards the rear or the posterior. So in the neck on an x-ray, we want to see a nice curve there for. I would not want to see loss of curve like this. Now, we didn't take x-rays of your neck. We took low back, but we're going to just go over the whole description so you understand what the whole spine is like. Over time, the spine can degenerate where you can thin the disc like this one right here, grow extra bone. These are called bone spurs, osteophytes, and then it can become a solid mass of bone. So that is a major neurological problem now at this point in time. So whether it's the cervical, thoracic, or lumbar region, it's the same kind of degenerative process that can occur. Usually through trauma, it accelerates destruction. So in the lumbar spine, we want to see that nice curve, good spacing in between. Thoracic spine, again, good spacing, good vertebrae. And you can see over time, if we have misalignments, we call those subluxations, and subluxations turn into a degenerative cycle. And so this spine is straight, we have degeneration on the disc, and this is degenerating as well, and you can see that here it's trying to grow together or fuse together. Okay, so I'll give you a little bit more explanation before we see the x-ray. So from the rear, the spine should be perfectly straight, just like I identified a moment ago on this picture right here. So we have the nervous system, which is the most important component. So your brain controls everything in the nervous system, and then everything in your body. So the nervous system is a connection between the brain and the body. Out of alignment in some fashion is going to irritate these nerves to some degree. 5%, 10%, 50%, just depends on how bad it is. So any misalignment, we call a subluxation, irritates the nervous system, less flow. So if that nerve happens to be going to your liver, we can have liver issues. Doesn't mean that the liver can be repaired by taking pressure off this totally, but the more pressure you have, the less function you have down the other end. It's an electrical wire, basically. And so if you're sending an electrical signal to the liver to work, or the heart, or the lungs, or the thyroid, or a muscle, if you decrease the flow of that, you're going to have a bigger problem on the other end. In an extreme case, let's say you severed that nerve. Well, then other side of that's not working properly, right? So we see in spinal cord injuries, you damage the spinal cord severely enough, then what are you going to have? You're going to have either a partial paralysis, full paralysis, or if you did it in an extreme way, you may have death, right? So we saw this with the actor Christopher Reeves. He jumping a horse, and he fell off the horse and he broke his neck. He damaged that spinal cord so severely, he was then paralyzed. He maybe took several years before he passed away, but enough damage creates a problem of flow of energy to the body for the body to work. So we care about any misalignment, whether there's a pain signal or not. So about 10% of our nerve fibers give us pain signals. About another 90% approximately make things function. So right now my pancreas is working, my liver, my heart, etc., just as yours is, but they may not be screaming out to you in pain, but your muscles might. Your skin might, right? You might have irritation to the skin, to the muscles, they're hurting, you might have spasms. So there's a lot of nerves that can be affected. So that nerve root coming off the spinal cord right there, if that is pressured enough, as we said, a misalignment of some fashion pressuring that nerve, then you're going to have less flow. Where this nerve branches off to several different areas of the body, all are going to be affected. So in an opposite way, if I cut my finger off, I'm unhappy because I cut my finger off. My nerves tell me it hurt, but eventually the pain goes away, but I can live the rest of my life without that finger. You can cut my arm off, I can live the rest of the life without my arm as well. But the closer you get to the spinal nerve root or the spinal cord, or then up to the brain stem or the brain, the more damage you have everywhere. In other words, we have systemic damage. So that's the nervous system in a nutshell. It has to control and regulate everything, whether you have pain or you don't have pain. So we always care whether there's a misalignment, and the person can say, well, I don't really have pain at that level. Yes, but you're going to have malfunction. Eventually, you're going to go through a disease process, and eventually you might wind up with symptoms. Now, it could take 30 years, it could take 40 years. Just depends on the person, just like there are other weird things in life. You have kids dying of cancer, and you have people who live to 100 and they smoke and drink and do drugs. So the rest of us are somewhere in the middle, that if you do enough of the right things, the body treats you pretty well. Do enough of the wrong things, it gets you earlier. So that's the nervous system. Mechanically, these are the discs. These are the cushions that create a hole for that nerve root to exit, right? The spinal canal is right here. And that spinal canal needs to be open so that that cord runs through there unobstructed. So if that closes up, what we call stenosis, then we're going to have a problem with the cord and different areas where that nervous system distributes its information. Here at this foramen, or this hole where the nerve exits, if that disc is degenerating, we're going to have pressure on that nerve. The disc can also tear or bulge. So this is an example of a bulging disc. It's a little hard maybe to see from the video, but that disc is pushing out. Like if you grabbed a balloon, it's going to pooch out. That's going to push on that nerve root and cause problems. That disc can also then degenerate over time from the misalignment. Remember, if we have a misalignment, we're putting too much pressure. Let's do it this way. Misalignment, now we're going to put too much pressure on that disc and on this disc, and over time, mechanically, that can fail. So the disc might start to tear, might leak out, might bulge, putting pressure on the nerve. The other thing mechanically that happens, Bertha, is that instead of these joints moving properly and gliding as designed, out of alignment creates a wear and tear situation on those joints. This, the brain doesn't like, and it says, well, let's try and repair this to the best of our ability. And what it'll do is lay down extra bone in here, calcium deposition basically, and become jagged and irregular. And so this is a destructive process. This is a degenerative process. And this is when the doctor will say, oh, you have arthritis, because what is arthritis? It's an inflammation in the joint, and the inflammation is created by a misalignment or by the roughening of those joints as it degenerates. Now, we have a natural degenerative cycle. We all get gray hair, we're going to get wrinkles, and muscles start to atrophy a little bit. So we're going to wither away to some degree, but we don't want to advance that destruction. And we advance destruction through trauma, and we advance destruction through misalignments. And that misalignment could be caused by trauma, or it could be just normal wear and tear of your life working hard. A roofer hauling shingles up to the top of the roof for 40 or 50 years is going to have traumatic incidents over time. Somebody cleaning houses all their life. So repetitive trauma as opposed to one trauma. One trauma would be you have a car accident, break a couple vertebrae, and now we're going to have maybe 10, 15 years down the road some arthritis in these joints. Repetitive trauma is what we just described. So over time, wear and tear event. So in alignment, perfectly fine. Out of alignment, a wear and tear. Whether you break down in 10 years, another person might break down in 40 years. That's the way it goes. So over time then, you go through that complete destructive cycle, extra bone growth, and now the disc is shot. It's like a dried out piece of meat. And that's what you don't want to be, because the big problem is these nerves again. Now, the vertebrae used to be up here, spaced by a nice healthy disc. The nerve root was nice and thick and healthy, as you can see here on this model. Okay. Now, instead of being like that, we're slowly degenerating, trapping the nerve, and now we have major neurological problems, and then people wonder why they have all these issues, depending on where that nerve travels. The other thing that occurs then is muscles. Now, muscles in the back, you have layers. You have little muscles like this, and then you have layering of muscles. If I misalign the vertebrae in a basic way, that muscle is being compressed, pinched, squashed. Use whatever word you like interchangeably. This muscle is being pulled and stretched. So we have constant tension over here, and we have constant compression here, even if you're sleeping. Then you go to do a normal daily activity, might be sweeping, might be bending over the sink to brush your teeth, any number of things, washing your hair. Depending on where this is now, you're going to be aggravated. Over time, those muscle fibers as well will change. You get scar tissue. And scar tissue is just like cutting yourself on the outside and getting a scar. Some people get a little tiny scar, other people get a big scar, a keloid scar. So we don't know exactly how much scar tissue one person has versus the other, but you can darn well say that if it's misaligned and is that way for years, you are going to develop some scar tissue in these muscle fibers. And of course, now we have maybe a pain generation. Okay, so that's enough of the buildup on the models. And now that you understand that, let's take a look at your x-ray. So we're going to look at the x-ray in this manner right here, from the rear. Okay, so right side, and so let's look at you. Now, we were mainly looking at your low back area when we took this film. I didn't ask you to remove the bra, although I normally would if I wanted to image higher. It's not interfering with what we want to see, but you can see the underwire of the bra and the hooks. So if we look at the spine right here, you'll notice that it curves off to the left side, and then it comes back and curves off to the right side. Now, we don't know what's above it. If you wanted to see what is above it, then we'd have to take some extra x-rays. And we could take x-rays of your thoracic spine fully and your cervical spine, your neck, if you choose to do that. That's not a problem. But we were concentrating on this area right here. That was the area of your major complaint, your pain. So when we look at this and compare it to that x-ray, what you're going to notice is a huge, huge difference, okay? It's probably very shocking to you to see that. Although you might feel a little of that, maybe you see a little bit of that in the mirror, but it isn't as real to you as when you see the x-ray, because this is like looking inside your house, right? So I measured it right here at 31 degrees. Now, I didn't measure this because there's a little bit more up here and I couldn't get it, I wouldn't be able to get an accurate measurement, but you can see that curve right there is somewhat similar to this, so it's probably close to that 31 degrees. So we have a double curvature right there. And some people call that an S curve, right? And so one other thing I want you to pay attention to is this bony prominence right here. This is what's called the spinous process, and that bony prominence are the bumps that you feel in the back, right? So as you go down from the base of the skull all the way down to your tailbone, those are the bumps. So obviously, we would not want to see a vertebrae rotated one way or the other to any great degree, right? Tiny misalignment, that's okay, but a major misalignment, we're getting a lot of torsion or torquing in that spine, right? So when we look at an x-ray, they show up like these little marks here, sort of an oval look to it. Another one here, here, there, there. There's one I already circled prior to setting this up, and then you can see it straightens out a little bit here. So in other words, to make this clear, if you look at these bony prominences here and you measure from there to there, I mean, you don't even have to measure, you can see it as I pointed out. But if you wanted to measure, you could see that the distance between there and there is much shorter than the distance between there and there. So what you're visualizing is that down here you're pretty centered, but at that level you start to rotate greatly. So now we have a great rotation or torquing, and then we go into the curve, and then we come back a little bit straighter, and then we go into more curve. So this is real hard on your body. I can't do it with a model, but you're getting this kind of torsion, and that's why there's a shorter distance there than there is there. You see more bone on this side, right? So we get this torsion of the spine right here, as well, at the same time, it's curving. So once again, curving, torsion of the spine. Now, that puts a tremendous pressure on the spinal cord, and a tremendous amount of pressure potentially on these nerve roots coming off of the spinal cord, as you might imagine, as I do something like that. Okay? As well as the discs, as well as the joints and all the muscles that we already talked about on these models. Now, additionally, if you look at the vertebrae being nice and smooth and fairly squared off, and you look here, you see it's fairly straight down. It's got a nice corner to it. I think you would agree with that. Now, if we look at this one down here, what do you notice? It indents, and it becomes pointy, and it becomes pointy over there. So at this level right here, you've got a lot of pointiness, which is exactly what I'm showing you here. These are called osteophytes or bone spurs. So, bone spurring there, you also have it on this side, so there's several places that you have it. If you look here, indents a bit, it pooches out, versus that side which is more squared off. So a lot of spurring going on here as it's trying to grow together and fuse itself naturally. And you can look at this one and you see how tight it is on that side, right? And how open it is on this side. So that level, you are basically creating a wedge effect on the left side, pinching down over here, opening up on the other side. You have the bone spurs, you have the curve, and you have the torsion. So, wedging, curvature, torquing. That's a lot, right? And that's what your body has to handle. Now, again, up above, we don't know. There's probably some compensation there. I did want to point out one other thing which is good. From the top of your leg bones, right here, the femurs, I measured from that side to this side, and that left side is just a little bit lower than the right side, very marginally so. So in essence, your pelvis is nice and level. That's good, okay? It's like the foundation of your house. That's nice and level. The problem is the spine, which would be like your house with the boards torquing and twisting, okay? So that's what's going on from this view right here. The side view, if you remember, I said your spine should have a curve in it. If we can look over here a bit, Ambrose, you'll notice nice curve in the spine, okay? So right there is good curve, nice curve on the example of an x-ray, good spacing in between, nice and squared off vertebrae, all looks really good. And if we come back over here, now you're going to notice there's no curve. Okay? You've lost the curve. So just in a free hand, don't hold me to the exact measurement, but that is approximately what I'd like to see. A nice, smooth, gradual curve. But you've lost that curve totally. So it's straight. So instead of it'd be like this if my arm is the spine with a curve, but now you've straightened it like this. And we're going to be jamming up joints all through here. And we saw in the other picture, because if you're torqued and if you're twisted and you're curved, you're going to be putting excessive pressure on the disc. The disc will wear out. And so if you look at this, you see a lot of roughening in here, just like that model. And as you go down, you're going to see very thin in between. Look at this one. This is a great example right here of very thin. It opens up a little there. It's changing. The vertebrae, the bodies of the vertebrae themselves are changing. The discs are getting squashed. They're being compressed. They're probably very fragile. And so that's what's happening in here. You're going to potentially put pressure then on all the nerves that exit through these holes, what we call foramen. So here we are, just a tiny bit actually reversed there, just a little bit, and straight. You have a tiny bit of curve right at that last section. Now this is a little hard to see and it's a little obscured. I don't like it as well, but if we turned all the lights out, looked at it in a dark room, we could visualize it better. But that's your last vertebrae right there, and there's your tailbone partially. And so you're looking through two hip bones like this, and so that's what you're seeing here. So there's a lot of overlapping of tissue, why it looks a little cloudy to you. But a lot of degeneration in the vertebrae and a lot of degeneration in the discs themselves. Now, just as an aside, this whitish area that you see right here, can you see that? I think you can. And that white area, that would be your abdominal aorta. Now, your aorta should not show up on a film. So in other words, you're going to be pumping blood out of your heart up here into your arteries down here to the abdominal aorta, and that's going to branch off and is going to your legs, right? So at that level, we're seeing, if my finger was the aorta right here, it's a tube, and we shouldn't see it. The only reason we see it is because it's full of calcium deposition. Okay? Now, you may already know that. You may have a cardiologist and may have talked about some of that. So this is what's happening there. If you haven't spoken to a cardiologist, that's a good thing to do. Okay? It's an incidental finding, but I just wanted you to be aware of it. Okay? And so the only other thing to tell you, which has nothing to do with the spine itself, but if we go back onto this picture from the rear, you'll notice a lot of dark, okay? And all of this is gas in your GI system, which is a little bit excessive. So this tells me a couple things. The nerves going to your GI system is not working properly to some degree, probably because of the misalignments that's irritating the nervous system. That's one potential reason. You can also just not be digesting food properly, possibly part because of age-related, but there may be some other issues with that. And generally when we see a lot of gas like this, we have somebody who's a bit constipated. Maybe they don't go to the bathroom as much as they should. You know, if you think back to babies, you feed a baby, it poops. You feed a baby, it poops. And basically, we should do that as well throughout our entire lifetime. So when people start having issues with constipation, and some women have it more than others, but if you're not having a couple bowel movements a day, you're becoming toxic from the waste material, and we should find ways to help you to eliminate on a daily basis. But that's an indicator to me that nervous system is not working properly, GI system is not working properly. Now, the other thing is, you could have just eaten that day before I took the x-rays a lot of foods that have a gaseous response, right? So beans, broccoli, things like that could create some of that issue. But I would venture to guess that this system is not working properly, and that's why we have issues, okay? So that's what's going on there. You have a little bit of lung tissue showing here. These dark spots up here is not gas, that's lung tissue, but that is gas. Gas all the way through here, okay? And right there, a tiny bit of your heart shadow, okay? That would be your heart right there, that whitish area that you see there, okay? So we have proof that you have a heart. We knew that already, okay? But there it is. So that's your x-rays, and so this is a reason why chiropractic care would be very beneficial in your lifetime, whether that's me or another chiropractor or working in combination with another chiropractor. I'm happy to do that as well. This is not going to be solved. This is not going to be corrected, but you can get some more relief, and you can actually start to straighten up these curves a little bit and take some of the torsion out. So as you get older, that you have less and less problems. It does take a lot of work because you've lived with this a long time. So I'm not just telling you there's a fast, instantaneous fix to this. You know, the dentist can put braces on your teeth to try and straighten your teeth, but it still takes a couple years to do that, even with the braces on 24 hours a day, 7 days a week. So with chiropractic care, we can work on you, one, to get rid of pain, two, to try and fix as many problems as we can fix so that you can be as healthy as possible. But I would say to you, just as if you were my relative, if you were my mother, this just takes constant care. And it's up to you how much care you want to help yourself with this issue, okay? And I'd be happy to discuss that with you in more detail, for sure. So that's your x-ray. I wanted to talk